Telehealth: Shaping the Future of Medicine by Lauren Stover. Medicine, as we know it, is constantly changing. New products, devices, and even diseases are being discovered each and every day. As healthcare workers, it is our responsibility to know and understand all of these new products. One of the newest medical technologies that is starting to arise is telemedicine. Currently, with the scare of coronavirus, we are seeing more and more healthcare providers setting up telemedicine calls in order to keep patients at home, but still being able to assess them and help them with any medical issues that may arise. Telemedicine is becoming the wave of the future. But why is telemedicine so important? What are the effects, both short-term and long-term? What barriers will be involved? And what recommendations can make this new technology better? Telehealth goes clear back to the 1960s with the landing of the man on the moon. One of the effects of sending a man to the moon was that people were able to monitor the astronauts, which was how telehealth was born, according to McGonigal and Mastrin. Why is telemedicine needed? The first question we need to address is, what is telehealth? According to Hall and McGraw, telehealth involves the use of telecommunication technologies to prevent and treat illness and promote health of individuals and populations. Telemedicine can be used in any area of care, such as in the emergency room, on inpatient units, for psychiatric patients, or for routine follow-up visits. Examples of telemedicine include the following: email, patient portals that allow patients to talk with physicians and also access their recent results, remote patient monitoring systems such as insulin pumps, and live video conversations between patients and physicians, according to Greenlight Medical. Telemedicine is needed because of the decrease in physician rates, which leads to many Americans not having a primary care provider. The decrease in physicians is leaving over 65 million Americans in primary care deserts, or areas where the number of primary care physicians meets the needs of less than 50% of the population, according to Greenlight Medical on paragraph 5. When citizens are not receiving routine visits, it leads to the decrease in finding illnesses, which in turn leads to more frequent hospital stays and the increased susceptibility to more diseases. For example, patients who receive yearly checkups are more likely to find cancer or other illnesses than those patients who are rarely seen by providers. We have seen that there are not enough providers to care for the influx of patients that need to be seen. Using technology to provide health care remotely is seen as a major strategy to address the continuous increase in the demand for care, according to Hollingwing et al. On page 50. Telemedicine is the coming of the future when it comes to communication in medicine. One day, providers will not be seeing patients in the office. Instead, they will be seeing them from a computer screen. With the advances in technology, we will see this much sooner than we think. But what are some of the effects of this new coming of medicine? Short-term effects on practice. One of the main issues with seeing a provider is wait times. How many times have you gone to your doctor's appointment and had to wait 20 minutes over your scheduled appointment time to be seen? Sadly, this is happening all the time and is one reason many patients are not going to routine visits. Another issue that patients are having is that it is taking them months to be able to be seen by a provider. A 2016 survey stated that over 50% of adults struggle to see a primary care provider during non-work hours, with wait times for appointments exceeding 29 days in certain areas of the country, according to Greenlight Medical on paragraph 6. Telehealth cuts wait times, which allows patients to be seen quicker than before, thus leading to the ability to address growing health concerns. However, as more providers start using telemedicine, wait times may start to increase. Another study showed that over the first year of a provider using telemedicine, in-person visits decreased by over 33%. However, after the first year, in-person visits returned to the same level that they were before implementation of telemedicine visits, according to Meyer. In the short term, telemedicine was able to reduce the amount of patients actually seen in the office by the provider, but in the long term, the amount of patients seen in the office went back to normal, thus showing that telemedicine was not effective in the long term for reducing the amount of patients seen in the office. As many of us working in healthcare have seen with the COVID-19 virus, telehealth has provided some short-term effects on practice and client health. During this pandemic that we are currently facing, many offices have turned to telemedicine to be able to see patients in order to still meet their needs but contain the virus. The use of telemedicine has been able to help control the spread of this virus. It has also allowed patients to be in contact with their primary providers about their symptoms as it relates to the virus without going to the ER. By patients talking over the computer to the providers about their possible COVID-19 symptoms, we are able to keep the ERs clear for any actual traumas or emergencies that may come in, according to Acker. We also are helping to contain the virus by reducing the amount of human-to-human contact. Thus, telemedicine has helped to contain the spread of this new virus. Telemedicine has many short-term effects on practice that benefit not only healthcare workers but also patients and patient satisfaction. Long-term effects on practice. Have you ever gone to the emergency room and had to pay a copay just to be seen? Most people are paying outrageous prices out of pocket just to be seen by a provider. However, the long-term effects of telemedicine could save Americans hundreds, if not thousands, on medical bills. On average, a digital appointment costs between $40 and $50, while an in-person visit can cost the patient much more. By implementing telehealth as a first step before a hospital visit or for use in non-emergency situations, both the patient and providers can cut costs, according to Greenlight Medical on paragraph 4. In the long run, studies have shown that telemedicine could save over $6 billion annually. Another long-term effect that telemedicine has on both practice and client health is it enables the use of smart surveillance cameras. These cameras are placed in older patients' homes and notify caregivers/family members of changes in activity, fall, or lack of movement. By being able to use these devices, patients are able to stay in their homes longer. With the increasing number of people aged 65 or older, nursing homes will be unable to handle the amount of people needing placement. Therefore, telehealth devices that are able to detect these changes will decrease the number of residents in nursing homes and also still providing older adults with the independence that they want and need. Also, being able to detect if a person has fallen makes it so older individuals are not laying on the floor for hours upon hours. It will also decrease the time that it takes for help to arrive, according to Lundy. Telemedicine devices have been shown to be effective not only in the short term, but also in the long term. Telemedicine has been proven to create a stronger team-based care approach. Telemedicine allows for other specialists to get involved with individuals' care easier. A study done on a hospital in Arizona showed that a combination of team-based care, telemedicine, and home monitoring technologies reduced unnecessary hospitalizations by 45%, according to Howell Telemedicine, paragraph 8. Telemedicine has created team-based care that in return has resulted in a decreased amount of patients being admitted to the hospital for non-emergent reasons. As you can see, telemedicine has long-term effects on both client health and the future of medicine. Telemedicine has been shown to decrease the amount of money patients are paying to be seen, increase independence in the elderly, increase the amount of time the elderly can stay in their own homes, and has created a stronger team-based approach to medicine. Barriers to implementation. Although there are many short and long-term benefits of telemedicine, there are also some barriers to the implementation of such high advanced technology. One of these barriers is the difficulty of using technology, especially in the older population. One of the common statements we hear from older patient populations is that they do not know how to use technology. One of the biggest barriers to the implementation of telehealth will be getting the older adult population to be on board with this type of communication. We have seen it time and time again with the advances in new technology. The younger populations fare pretty well at adapting to the changes. However, the older adult population tends to avoid the changes or has a terrible time figuring out how to use it. Educating the older adult population on the use of telemedicine will be needed to ensure they are receiving the appropriate care that they need. Due to telemedicine being a part of a computer system and web-based, the chance of a third party hacking into clients' information is a risk that will be taken. Due to this risk, patients and providers must trust telehealth systems to keep personal information private and secure, according to Hall and McGraw on page 216. Patients must be informed immediately if a breach in information occurs, as this would be considered a breach in HIPAA. Being able to trust the system that you are using is something that may be difficult at first for many users to do. Providers using such high-tech technology will need to have proper security systems involved and will need to ensure that the staff involved in telemedicine understand the rules of HIPAA and that they still apply. Only authorized users should be approaching these systems. By restricting access to personal information stored within these telehealth systems, we are able to increase patient safety while also reducing anxiety caused by potential misuse. Security mechanisms must also be put into place because such systems use a combination of physical and logical restrictions to ensure a higher level of protection from outside threats. Providers who are using telemedicine need to be constantly updating their security systems as viruses are constantly being created, according to Alundi. Although these breaches in the system may become a barrier, they can be avoided if the proper steps are taken to ensure that only appropriate staff are using the systems and that all security systems are up to date. The last barrier that we are going to talk about is in relation to legal and regulatory issues. In the United States, nurses and physicians practicing in more than one state must have a license to practice in each state. With telehealth, healthcare workers must ensure that they have a license to practice in the state that the patient resides in. This mainly affects facilities that are located near state borders and draw patients from both states, according to McGonigal and Mastrain. A barrier that is seen is that many physicians and nurses must try and get a license in more than one state, which can be time-consuming and costly. Although there are some barriers to the implementation of telemedicine, it brings more overall benefits than it does issues. By working on the implementation of these systems into healthcare, we can help eliminate these barriers. Recommendations to implementation. With every new advancement in technology, there are always some recommendations on how to effectively implement the new technology efficiently. Many people struggle with change, especially if they feel overwhelmed. The first recommendation for implementation is to make sure that staff are properly educated on how to use telemedicine machines and what type of movements are required for the patient to be properly assessed by the doctor on the other end of the line. For example, on my unit, we use telemedicine for our stroke patients. A doctor out of UPMC in Pittsburgh gets on the other end of the computer and a nurse performs the NIH scale, so the doctor can see what physical defects that patient has. Therefore, the nurse must still be able to perform this assessment and understand the questions that the doctor asks of the nurse. Another recommendation is to ensure that technology is user-friendly. Many older adults will be using telemedicine machines and computers and may struggle if the devices are not easy to understand and use. The technology being used also needs to be high quality to ensure that the providers on the other end can understand patients and get the full extent of their issues, according to Rosario. It is important when implementing something new to make sure that you have the focus on maintaining patient satisfaction. In order for telemedicine to work and to be efficient, patients have to feel satisfied with this change in service. Maintaining patient satisfaction is something that must be considered when implementing telemedicine into any new healthcare facility, whether that is in a primary care office or in the hospital setting. Lastly, ensuring that facilities participating in telemedicine use proper security systems is crucial to the implementation of telemedicine into their facility. Proper security systems ensure that there will be no breach in patient information, allowing for a more trusting relationship between providers and patients. There are certain things that need to be addressed when implementing telemedicine. Some of these include proper training and education on the systems being used, ensuring they are user-friendly to all population and age groups, and making sure that they are the highest level of technology will enable telemedicine to be successful now and for years to come. The American Journal of Accountable Care states the following: telemedicine aims to meet the needs of today's healthcare consumers and has the capacity to revolutionize the delivery of healthcare. It supports efforts to significantly improve the quality of healthcare by increasing accessibility and efficiency through reducing the need to travel, providing clinical support, overcoming geographic barriers, offering various types of communication devices, and improving patient outcomes. Thus, given the current focus on efforts to contain costs, improve the delivery of care to all segments of the population, and meet consumer demand, telemedicine is an attractive tool to use for success in these areas, according to Lundy on page 1. Telemedicine is the new era of medicine. With devices that enable doctors and nurses to see patients in their own home, telemedicine is the wave of the future. Telemedicine has many short-term and long-term goals, which include decreasing wait times, allowing for the spread of viruses to be minimalized, decreasing the overall out-of-pocket costs of being seen, allowing older adults more independence, and maintaining a team-based approach to healthcare. Although telemedicine has a lot of benefits, there are some barriers to such high advanced technology. Many of these issues can be fixed with proper training, education, and security systems. Telemedicine is just the beginning of a new generation of medicine. Although change can be hard, this one is sure to bring many benefits to the future of medicine.